Welcome back to Senior Healthty Care, where you will discover several recommendations for seniors. Today we offer crucial recommendations that seniors should not overlook over 50, 6 mindful walking tips that transform mobility for senior wellness, from Janpanese. The fact that Japan continues to be one of the countries with the longest life expectancy, and that it has a disproportionately large number of centenarians, the government claimed that there were over 9,500 persons aged 100 or older in 2022, has prompted researchers to investigate the factors that determine remarkable longevity. Cross-disciplinary observation shows habitual culturally imprinted movement behaviors that are adopted by a large number of elderly Japanese seniors. Diet, genetics, social organization, and healthcare systems are all known to be factors in the phenomenon. With the help of this study, the notion that a collection of low-impact functional movement activities that are incorporated into everyday life, rather than being predominantly defined as exercise, may significantly improve physiological resilience, neuromuscular integrity, and prolonged independence in later age is advanced. Following are 6 such movement patterns that are explained in detail, with each one being placed within a cultural context, defining the mechanics involved, providing a summary of the empirical and theoretical grounds for health impacts, and providing pragmatic suggestions for the safe adoption and development of the movement patterns. 1. Example: walking at a slow pace and mindfulness. In addition to cultural practice definition, the term sampo, which is generally translated as a stroll, refers to a kind of walking that has significant cultural significance in Japan. This form of walking prioritizes mindfulness, sensory engagement, and a deliberately leisurely rhythm above speed or physical effort. Many people who are in their later years engage in sampo as a regular, usually daily exercise. This activity is typically carried out in urban green corridors, parks, temples, neighborhoods, and riverbanks. It is typically done in the morning when the air quality and pedestrian density are at their best. The practice is distinguished by an attentional ethos in which practitioners pay attention to their breathing footfalls, surface textures, seasonal changes, and the social rhythms that are present in the environment. There are instances when coordinated breathing patterns are used, such as inhaling for 2 steps, holding for 2, and exhaling for 4. These patterns are similar to methods that are utilized in contemplative traditions. The purpose of this exercise is to develop a state of calm embodied attention while simultaneously activating the body in order to produce psychophysiological and motoric consequences, mechanisms that are neurological, biomechanical, and physiological in appearance. When compared to vigorous aerobic walking or weight training, slow attentive walking stimulates these systems in a manner that is distinct from the other two. The regulated breathing that is characteristic of sampo improves parasympathetic tone, which in turn lowers resting heart rate and blood pressure and attenuates stress-related cortisol spikes. As a result, these improvements are associated with enhanced heart rate variability, which is an indication of cardiovascular flexibility. Slow walking needs constant micro-adjustments in ankle dorsiflexion, plantar flexion, tiny variations in foot location, and controlled heel-to-toe roll. This is because slow walking demands a greater dependence on sensor-motor control and proprioceptive input than a faster walking pace. These modifications include the recruitment of the intrinsic foot musculature, the tibialis groups, and the peroneals, which are structures that are essential to gait and balance. Because of the decline in proprioceptive acuity and reflexive reflexes that occurs with age attention, focused slow walking has the ability to maintain afferent input to central brain circuits that are participating in postural regulation. This helps to maintain the sensory motor loop that is responsible for maintaining balance. The biomechanical benefits of slow, varied terrain walking include the promotion of joint range of motion at the ankle, knee, and hip, while simultaneously limiting peak ground reaction forces. This type of walking also helps to support synovial fluid distribution and cartilage nutrition through cyclical loading, all without exposing joints to high-impact stress, which can exacerbate degenerative disease conditions. Observational and clinical research that relates frequent walking to decreased arterial stiffness and better endothelial function implies that SAMPO may very well share the cardiovascular advantages of walking, especially when paired with autonomic modulation via breathing. Improved attentional control, reduced rumination, and greater mood regulation are some of the downstream cognitive and emotional advantages that may be achieved by the practice of mindful attention during SAMPO, which functions as a sort of movement meditation. There is evidence from neurophysiology that suggests that regular mindful movement is associated with changes in networks that are involved in executive function and interoception. These changes may be responsible for the cognitive resilience that is associated with aging. Last but not least, SAMPO often encourages moderate social involvement, such as going for walks with neighbors or participating in neighborhood organizations, which alone is beneficial to mental health and adherence. Positive psychological impacts are amplified by social engagement, which may also have the potential to indirectly boost physiological effects by enhancing sleep quality, reducing feelings of isolation, and promoting healthier behaviors. Evidence based on empirical research and limits. A limited number of randomized controlled trials, RCTs, that precisely isolate SAMPO have been conducted. Nevertheless, a substantial body of research on slow walking timed breathing and walking-based mindfulness provides evidence for many of the processes that have been characterized. Walking habits have been associated with lower functional decline and cardiovascular risk, according to observational studies conducted in Japan. These results give ecological confirmation. SAMPO is a practicable public health supplement because of its cheap cost minimum risk and potential multiple benefits. However, causal inference is hampered by confounding, which means that frequent walkers may vary on food social integration or access to healthcare. Constructive advice for the adoption process. Neither specialized tools nor equipment is needed. The recommended starting time for beginners is 10 to 30 minutes each day, with the goal of gradually slowing down to around half of their typical pace, adopting diaphragmatic breathing, and putting a focus on heel-to-toe mechanics. Individuals who have difficulties maintaining their balance should begin their exercise routine on level ground and may make use of a cane or an accompanying person. Moving on to uneven terrain, such as grass or gravel, will help them develop proprioceptive adaptation. It is possible to create a mindful present by paying attention to sensory qualities, such as temperature, scent, and visual detail. When it comes to physical activity, frequency and cumulative time are often more important than intensity. For older persons, it may be more possible and efficient to take numerous short walks throughout the day, rather than a single protracted episode. 2. Radio Taiso, a morning mobility routine, implemented across the nation. The value of history and culture. Radio Taiso, also known as radio calisthenics, is a collection of exercises that have been aired by NHK for a long time. These exercises are characterized by a specific musical pattern that symbolizes them. The public health effort, known as Radio Taiso, was first launched in 1928, with the intention of fostering collective morale and making the program accessible to people of varying ages and capabilities. As a result of having performed it when they were children, many Japanese adults remained acquainted with it throughout their whole lives. It became institutionalized in schools, companies, and communities. In the case of senior citizens, it functions not just as a physical introduction, but also as a social ritual that places mobility within the context of community time and identity. Compositional makeup and the properties of movement. Radio Taiso is a quick sequence of motions that include the whole body and are executed together with musical and verbal signals. These movements are performed in a continuous flow. Dynamic mobilizations are strongly encouraged throughout the sequence, including, but not limited to, arm and shoulder circles, lateral trunk flexions, spine rotations, hip abduction and adduction leg swings, and partial squats with coordinated weight transfers. The whole practice is brief, lasting around 3 minutes, and has a focus on fluidity, symmetry, and movement that is synchronized with the breath. The intricate patterns that would discourage participation are purposefully avoided, and the amplitude and speed of the pattern may be altered to accommodate individual restriction measures. Ways in which one may profit: neuromuscular priming, joint mobilization, and sensory motor reinforcement are some of the advantages that may be attributed to regular radio-taiso practice, despite the fact that it is short and has a low strength in absolute intensity. Reducing morning stiffness and improving synovial fluid distribution are two benefits of cyclical joint mobility, which is especially important for older persons who suffer from osteoarthritic rigidity. It is necessary to make anticipatory postural adjustments and activate the core stabilizer in order to shift weight and coordinate limb movements. This helps to reinforce neural patterns that are necessary for maintaining reactive balance corrections. The practice of repeatedly activating key muscle groups with low resistance is beneficial to the preservation of muscular tone and endurance, and it has the potential to reduce the effects of sarcopenic processes when performed on a regular basis. Morning exercise that is rhythmic is consistent with circadian biology. Light exposure paired with light activity alters cortisol cycles, which may improve daily alertness and the quality of sleep. Transient increases in peripheral blood flow and endothelial shear stress, which enhances vasodilatory signaling, as well as mild hormonal priming of metabolism, are examples of the neuroendocrine effects that may occur. Motivation and adherence are both improved by synchronous group execution, which also has additional psychological advantages. Evidence from the real world and the results of public health studies conducted in the community have shown a connection between regular involvement in radio-taiso and enhanced balance, decreased risk of falling, and maintained joint range of motion. After taking into account factors such as age and baseline function, large community surveys have shown that there is an inverse relationship between the frequency of radio-taiso and the occurrence of falls. Regular practice of such calisthenic programs has been shown to result in small gains in gait speed range of motion and self-reported physical function, according to intervention studies. The acceptance of radio-taiso at the community level and cumulative exposure to it provide important public health consequences, despite the fact that randomized controlled trials, RCTs, that isolate radio-taiso's effects from co-occurring behaviors are scarce. Implementation and accessibility are concerns. Brevity, little space and equipment needs, and cultural familiarity are the assets that radio-taiso has. In addition to being scalable by the modification of amplitude and cadence, it may be performed in homes, community centers, and even outside. Variations that are seated or have a lower amplitude are effective ways to sustain interest in elderly persons who have restricted mobility. Social involvement and adherence are both increased via the use of community-led workshops and broadcasts. 3. Reclaiming a fundamental postural pattern. Through the deep squat and its benefits, antecedents of culture and factors that influence behavior. Deep squatting, which involves lowering one's hips below knee height while keeping one's heels flat, was a common practice in ancient Japanese household life. To facilitate floor-based sitting and transitions, tatami floors, low tables, chabudai, and floor cushions, zabuton, were used. Additionally, squatting was introduced into a significant number of everyday activities. As a result of these contextual affordances, deep squatting became a normative motor pattern that was ingrained in everyday life. Furthermore, many elderly people still possess the flexibility and motor techniques that allow them to comfortably do deep squatting. The relevance of biomechanical processes and their integrated health effects. In terms of biomechanics, the deep squat is a movement that mobilizes the whole lower kinetic chain and generates loads that are beneficial throughout the spine. It is necessary to perform a coordinated flexion of the hip and knee, as well as a significant dorsiflexion of the ankle. This will extend the posterior chain muscles while simultaneously engaging the quadriceps during descent and ascent. Maintaining flat heels requires flexibility in the gastrocnemius and soleus muscles, which are essential for correct heel striking, toe-off, and shock absorption during stride. Also required is the ability to maintain ankle mobility. By distributing compressive stresses across vertebral bodies and soft tissues, deep squats, when performed with an erect torso and a neutral spine, have the potential to alleviate mechanical low back strain in comparison to sitting in a flexed position for an extended period of time. Through co-contraction with core muscles, the posture stimulates the pelvic floor musculature, which in turn supports continence mechanisms and pelvic stability, which is clinically significant in older persons. There is a considerable correlation between the ability to squat and rise and independence in conducting activities of daily life from a functional standpoint. Based on longitudinal data, it has been shown that maintained squatting is a reliable predictor of decreased impairment and a lower risk of requiring supported living. By adopting this posture, one may train their balance throughout a broad range of motion and get used to the movement patterns that are necessary for activities like picking up objects off the floor and navigating residential surfaces. The pathophysiology of loss and the ability to reverse it. The presence of chair-centric surroundings encourages the habitual mid-range flexion of the hip and knee, which is around 90 degrees. This creates an adaptive shortening of the hip flexors, a reduction in the hamstring's flexibility, and a loss of ankle dorsiflexion, all of which disrupt the ability to do deep squats. In addition to these deficiencies, age-related sarcopenia and stiffness of connective tissue are also present. On the other hand, partial or complete reversibility may often be achieved with the combination of focused flexibility and strength training, with frequently occurring low-load exposure to entire ranges of motion. Restoration is based on the concepts of motor learning and tissue adaptation. Consistent, moderately intense practice provides better long-term improvements than sporadic high-intensity efforts. Rules and regulations for the progression of recovery. The deep squat should be reclaimed in a manner that is both progressive and safety-oriented. The first tactics include practicing assisted squats with the assistance of a sturdy counterbed edge or stair rail, executing partial squats and managing eccentric lowering to activate quadriceps and gluteals while protecting joints, and putting a small wedge or towel beneath the heels to compensate for restricted dorsiflexion. Static holds in partial postures for 20 to 30 seconds, performed numerous times per day, encourage connective tissue remodeling and proprioceptive recalibration without causing undue stress. Gains are accelerated by the use of complementary therapies such as calf stretching, hip capsule mobilization, and progressive loading through regulated stand-to-sit repetitions, respectively. It is recommended that persons who have osteoarthritis, joint replacements, or balance deficits get clinical supervision. 4. An effective and convenient method for predicting and training longevity. Single-leg standing physiology of the foundations and integrative structural systems. Vestibular apparatus visual system and somatosensory proprioceptive receptors are the three primary sensory systems that contribute to the maintenance of balance. Balance is an active integrative function that is dependent on the constant synthesis of inputs from these three systems. In order to create anticipatory and reactive muscle activation, these signals are integrated via central networks located in the brainstem, cerebellum, basal ganglia, and sensory cortices. A deterioration in any subsystem that is associated with aging, such as vestibular hair cell attrition, lower visual acuity, or peripheral neuropathy, affects postural orchestration and raises the chance of falling. The integrated postural control apparatus is put under a great deal of stress while doing single-leg standing, which involves maintaining stability on one limb at certain periods. The activity places a greater strain on the stabilizing muscles of the ankle, knee, and hip. It requires accurate proprioceptive discrimination at the joints that provide support. It activates the vestibulospinal reflexes, and it uses the attentional resources of the cortex, particularly when it is conducted on unstable surfaces or when there is visual occlusion. Associations based on empirical evidence with health consequences. According to the available evidence, measures that measure single-leg balance are reliable predictors of health outcomes. Having a weaker balance is associated with increased chances of falling fractures, losing one's independence, and death, according to studies that follow participants over time. The practice of balance is associated with the preservation of regional gray matter, which is involved in spatial processing and motor control, according to an observational study conducted on Japanese cohorts. This suggests that balance practice may have neuroprotective benefits. The findings of clinical studies suggest that increases in the amount of time spent standing on one leg may minimize the incidence of hip fractures by reducing the chance of falling and boosting protective responses. In the process of predicting mortality from any cause, simple functional measures, such as standing on one leg, may compete with or even surpass established biomarkers. This is due to the fact that these measures reflect integrated physiological functioning, principles of training and procedures for progressive prescription. It is possible to integrate single-leg standing at any point throughout the day, and it functions as both a kind of evaluation and fitness training. To lessen the chance of falling, beginners should begin with a firm support, such as a wall or a countertop, and choose a fixed visual focus point, also known as a focal point. To begin, a cautious beginning objective would be to concentrate on maintaining an upright posture and steady breathing for 20 to 30 seconds on each leg once or twice per day. The progression is based on the principles of overload, which are as follows: increase duration, decrease hand support, close eyes to remove visual inputs, thereby stressing vestibular and proprioceptive reliance, introduce compliant or uneven surfaces folded, towels, balance pads, and add cognitive dual tasks to mirror real-world demands. It is important for clinicians to personalize progressions for patients who have vestibular deficits, neuropathy, or severe osteoarthritis. For patients with these conditions, adjunct therapy, such as vestibular rehabilitation, suitable footwear, and strengthening are effective in optimizing results. Considerations pertaining to safety and applicability. When dealing with balancing activities, safety is of the utmost importance. Those individuals who have a history of falling should work under supervision. The task's length and ease make it suited for use as a daily habit, for example, while waiting in line or while brushing one's teeth, which promotes high-frequency, low-dose exposure that is useful for neuromuscular adaptation. 5. As a composite measure of functional capacity, floor-sitting transitions are being considered, both the intricacy of the function and its clinical importance. The process of transitioning from standing to sitting on the floor without the assistance of a manual encapsulates multiple domains, including the concentric and eccentric strength of the quadriceps, gluteal, and hamstring groups, core control for trunk stability, flexibility of the hips, knees, and ankles, and motor planning for sequencing and coordination. The ability to move from one level to another is a wide proxy for functional fitness, since it is an integrated job. In middle-aged and older adults, the sitting-rising test SRT, which is a validated clinical assessment that scores the ability to sit and rise from the floor with minimal support, is associated with all-cause mortality. Specifically, those who performed transitions without using their hands or knees exhibited a significantly lower mortality risk over the course of the follow-up period in comparison to those who required assistance. Reinforcement of cultural norms and the consequential effects of loss on function, maintaining neuromuscular patterns and joint ranges that are essential for the activity may be accomplished by regular practice in environments where floor sitting is still considered the norm. Many individuals lose this ability in situations that are dominated by chairs, and they may not face the problem until after they have fallen. This often leads to becoming immobile for an extended period of time, being hospitalized, and losing their freedom. The capacity to move from the floor to the ground is preserved, which decreases this susceptibility and increases resilience following injuries. Rehabilitative practices and suggestions for classroom instruction. In order to restore function, it is necessary to do motor practice, lower limb strengthening, and graduated exposure. A number of early therapies include repetitions of sit-to-stand exercises performed from increasingly lower surfaces, eccentric control training performed during descent, and targeted strengthening of the gluteal and quadriceps muscles. Retraining an individual's motor sequencing and confidence may be accomplished by practicing partial descents into kneeling and then returning to standing. Technique coaching that emphasizes the use of momentum and leverage rather than an excessive dependence on the arms is beneficial. When arm support is initially required, the goal is to gradually reduce the amount of support that is required. Dispersed practice, which consists of a few repetitions performed numerous times each day, helps to improve motor learning and minimizes tiredness. The pain that joints experience during retraining is reduced by soft surfaces. Progress monitoring and risk classification are both made possible via the use of objective measures such as timed SRT. 6. Tenugui hibiki, also known as the towel twist, enhances both isometric conditioning and spinal mobility, execution cultural resonance, and description of the situation. In order to provide isometric and rotational loading that targets upper body stabilizers and thoracic mobility, the towel twist makes use of the tenugui, which is a ubiquitous thin cotton towel. The practitioner holds the towel with palms that are a little broader than shoulders, arms extended at shoulder height, and applies an outward pull as if intending to rip the towel, so establishing continuous isometric tension. The exercise is performed with the practitioner's feet shoulder-width apart and their knees slightly flexed. While keeping this tension, the torso is progressively rotated to one side while the hips are kept forward. The rotated posture is maintained for a short period of time before returning to the center and repeating the process on the other side, via the continued engagement of the stabilizer musculature and the provision of tactile input via the hands and forearms. Continuous tension distinguishes this from solely dynamic rotations, both physiological objectives and the reasoning behind their mechanisms. Through the use of the towel, twist the deep rotator cuff and parascapular stabilizers, which are muscles that promote scapular alignment and thoracic posture, are activated. Additionally, the upper back musculature resistant to forward shoulder posture is strengthened. Although these groups are often undertrained, they are vital for maintaining healthy shoulders, allowing for comfortable arm elevation, and reducing chronic pain in the neck and upper back. The rotational component places a focus on the mobility of the thoracic spine, which often decreases with extended sitting and might lead to compensatory hypermobility or tension in the lumbar and cervical areas. An increase in thoracic rotation shifts the rotational load away from the segments that are more susceptible to injury. Muscles in the hand and forearm may be strengthened via the use of isometric gripping and outward pull tension. Because grip strength is a reliable epidemiological predictor of health outcomes, greater grip strength is associated with lower cardiovascular morbidity, reduced disability, and decreased death from all causes. A straightforward and repeatable strategy to maintain grip capacity is therapeutically useful. Participation in coordinated cross-body tension and rotation activates bilateral sensory motor networks, which has the potential to improve communication between the two hemispheres of the brain, as well as cognitive motor coordination. Regular towel twisting practices have been connected with retained bone mineral density, improved grip strength, and a longer lifespan, according to data from an observational Japanese cohort study. However, it is important to take into consideration lifestyle characteristics that might potentially contradict the findings. A development of implementation parameters and parameters. You may plan the towel twist to occur once or twice a day, once upon awakening to activate postural systems, and once before going to sleep to reduce stress. The towel twist is quick, lasting between 1 and 2 minutes. A tenugui allows for modest isometric engagement without requiring an enormous amount of stress, and any light towel will do well. It is more important to place an emphasis on regulated motion and moderate continuous tension than it is to emphasize maximum force or movement that causes discomfort. Make progress by increasing the length of sustained tension, widening rotational range as thoracic mobility improves, and introducing unilateral variations for the purpose of correcting asymmetry. Individuals who have major shoulder pathology or who have recently had surgery should get clinical clearance. Changes such as a sitting posture and a decreased arm elevation lessen strain while maintaining the benefits of the exercise. Evaluation and concluding remarks. Sampo, which is a form of mindful slow walking, radio-taiso, which is a form of brief coordinated calisthenics, the deep squat, single leg standing, floor sitting transitions, and the Tenyugwai towel twist are the 6 practices that illustrate a coherent movement philosophy that contrasts with contemporary fitness paradigms that place an emphasis on episodic high-intensity exercise. These methods, on the other hand, place a focus on consistency incorporation into daily functioning and functional mobility. The minimal joint impact, the focus on full-range mobility, the development of sensoromotor integration, and the accessibility without the need for specialized equipment or gym infrastructure are all characteristics that are shared. These practices have a complementary effect on the body's mechanics. They preserve synovial lubrication and favorable biomechanics. They preserve and retrain proprioceptive vestibular and visual integration, which is necessary for balance. They sustain postural and stabilizer musculature to support daily tasks. They promote thoracic and spinal mobility and pelvic floor engagement. And they stimulate neuroplastic processes that support cognitive and motor function. As a result of the cumulative effect of frequent low-dose exposure over the course of years, it is plausible that capacities that are essential to independence, such as standing up from the floor, walking safely, and providing support for a single limb, are preserved. This in turn reduces the risk of falling and breaking bones, maintains social participation, and contributes to positive population health metrics. A larger ecological framework of longevity should be considered, which includes diet, for example, traditional patterns with fish, vegetables, and fermented foods, social structures that encourage intergenerational ties and civic engagement, accessible healthcare, and genetic influences. These movement habits should be viewed as synergistic components within this framework. The key practical qualities of the movement activities are their scalability, cheap, cost-limited infrastructure needs, and cultural acceptance. All of these factors raise the chance of sustained adherence across a variety of socio-demographic groups. When it comes to public health, they are considered adjuncts, since they are low-risk pragmatic techniques that support preventative and rehabilitative treatment. Restrictions, voids in the research and potential future directions. There are significant study gaps that still exist, despite the fact that theoretical processes and observational links may support possible advantages. There are not many randomized controlled trials (RCTs) of high quality that directly compare these approaches both separately and in combination with the standard of care or traditional exercise recommendations. Combining functional endpoints with longitudinal mechanistic studies that measure objective outcomes, bone mineral density, vascular stiffness, cartilage biomarkers, neuroimaging, indices of brain volume and connectivity, and inflammatory markers would increase the ability to draw conclusions about the causal relationship between the two variables. Evaluation of implementation techniques that promote uptake and long-term adherence across varied groups should be a part of implementation research. This evaluation should take into consideration socio-cultural adaptation constraints, such as mobility limits and chronic pain and equality of access. In conclusion, policy may be improved by conducting cost-effectiveness evaluations that contrast these low-intensity, high-frequency practices with treatments that require a significant amount of resources. This is a suggestion and a disclaimer. For the sake of knowledge and scholarship, this synthesis incorporates cultural observation and existing research in gerontology, physiology, biomechanics, and public health. It is not intended to serve as specific medical advice. Prior to beginning new physical activities, individuals who have pre-existing medical conditions, such as symptomatic osteoarthritis, recent joint replacement, cardiovascular disease, vestibular disorders, balance impairments, or previous injuries, should seek the advice of a qualified healthcare professional, such as a physician, geriatrician, or physical therapist. These kinds of practitioners are able to give personalized assessment screenings for contraindications and individualized progression plans that take into consideration clinical situations while simultaneously maximizing both safety and benefit. When it comes to population health practitioners, these movement techniques should be taken into account as low-cost and culturally adaptive components of comprehensive healthy aging programs that prioritize functional independence and quality of life. Thank you for watching the video. Please let us know your thoughts, and goodbye for now.